I want to welcome our audience to this L.E.A.R.N podcast. It is in these podcasts that L.E.A.R.N wants you to meet experts that can help you in your work as school leaders or perhaps partners in the education landscape. The topic for this podcast is counseling and support, and our guest is Jeremy Glauser, CEO and founder of ELuma, a mental health solution for all students across Tier 1, Tier 2, and Tier 3, including an online counseling support system for schools. On the L.E.A.R.N website, you will find on the research page under the COE of Health and the element of counseling and support, research in this area being discussed, along with potential resources to access. Jeremy, I want to welcome you to the L.E.A.R.N podcast. It's really good to have you here to speak with us about this really important topic and a very relevant topic, top of mind for a lot of superintendents and school districts today. I know you have extensive...
Pleasure to be here. Thanks for having me, Dave.
Oh, absolutely. And I know you have an extensive research and work background in the area of counseling and support with a special focus on online support. Would you please share with the audience some of that background and experience?
Absolutely. It's great to be with you today. Hopefully some of the resources that we talk about can help you get these amazing services to kids. I've been in education for 18 years, and much of that has been on the technology side, and spent a decade really bringing high quality professionals like LCSWs, school psychologists, school counselors to the students through video conferencing technologies and others. And it's really a passion of mine. My mission is to help kids achieve their full potential. And this is just an incredible time where we finally feel like there's momentum. There's so many kids who need the supports, who are suffering. And now that we have some momentum around addressing that with funding and programming, we can hopefully make a big difference.
Well, I'm certain that you are. And I know you're probably active in a lot of districts. About how many districts have you been active in with this work and your prior work as well?
Yeah, we're approaching 200 districts across the nation that we work with. And we sit in council with a lot of different organizations like CEC, CASE, NASP, and others to really fully develop a solution for counseling and support and really a full MTSS support system for all kids. And recently I joined the Kennedy Forum School-Based Mental Health Industry Council. And what's exciting about that is that the Kennedy Forum and Foundation is helping to create policy work around it. And we also have some exciting developments with government, nonprofit, and for-profit organizations coming together. And I'll be able to share more of that in the coming months as that comes together.
That'll be wonderful. I know I'm hoping to have you on a live podcast in the future, and it'd be wonderful to share that news and what that could mean. And, right now, especially this work is so important coming out of the COVID pandemic. We've seen so many reports around student mental health and even adult mental health. Now, I know there's a ton of research out there, and we can't possibly cover all that research in this short amount of time.
Yeah.
But I'd like for you to share some key insights or information that you think is really important about that research and work that is out there around mental health supports.
I appreciate the opportunity. There are two resources that I hope people can take away from this. The first one is from the U.S. Department of Education and taking the approach of defining what mental health is in combination with behavioral and social emotional supports. We get confused as a country at a large scale and even at a small scale when we start talking about these terms that intersect so much. So I'll share that resource and we can make it available. It's a great one. The other one that many of you have probably seen, and you mentioned, Dave, is the increase in suicide ideation has swept this country. And there's actually a lot of research. One of the researchers I've been following is Jonathan Haidt. And then Jean Tweng also. They've been doing a lot of cutting edge research around the spike in mental health disorders, predominantly depression and anxiety, that also correlate with suicidal ideation and completion. And the advent of social media, the prominence of cyber interactions and bullying, and the impact being tremendous on our teens. Generally speaking, ages 11 to 14 having the highest impact. Females in particular, males definitely, but the emphasis on taking care of our youth, helping them feel heard and seen. So again, I'm happy to share that research and how bringing supports through a combination of on-site and online practitioners and providers can really make a difference in a hybrid situation.
Right. And I'm assuming a lot of this has been communicated to districts you work with and becomes a part of your kind of, if you will, DNA in
Yeah,
that communication pattern. Would that be correct?
absolutely. One of the things that districts, I would recommend that every district does is a readiness assessment, no matter how mature the model is and the programming, because there are always opportunities to say, what are we doing well and where can we improve? And then taking a full MTSS program and approach to MTSS. So, as a matter of fact, we work with Pittsburgh Public Schools, and they've taken this very approach, and it's been incredibly successful. But it wasn't at first.
Right. Uh-huh.
At first, it was a little messy and difficult, and the leaders in that district came together with commitment to serve these kids. And at first, it was hard to, get universal screeners going, make sure the referral process was accurate, that kids who needed this service were getting the counseling that they needed. But after some time and working in close partnership, the wheels started turning, and it's been a great success to the point where this partnership has now we've just entered into an extension for 2 more years, and it shows a commitment from the school, it shows confidence to the community, and it gives the students a resource that they can start to rely on because of the consistency.
Well, you just actually segued wonderfully, and I'll give you an opportunity. But one of the things that I think is so important as districts go down a pathway of any kind of work that they do is that they think about how they communicate that out to their internal and external communities, and specifically those predictable positive outcomes. You've just listed three, that you can communicate at on the onset of this work. Is there anything else you would say that's really vital to kind of communicate out to your public? This will really be a positive outcome if you do this kind of work.
Yeah, it's very clear that although mental health disorders and issues are not new, the programming around it in a school setting is relatively new. For a long time, we would hear, oh, that's for the healthcare system. And what we're finding is that the schools are really positioned to help battle these mental health issues. And so it's first recognizing that as schools we're battling a lot of fronts before we're really able to teach curriculum. But I think that that's the evolution that we're going through, is that the need in our schools to address mental health, among other things, is critical to a student's learning. So number one being programming and communicating out to our communities what are the key elements of our programming. And to be able to do that, we need to understand what our programming is around universal screeners, our referral process. What does counseling look like once a student is referred? And those are the key milestones that we can start to communicate statistically and success stories around. The other one is long-term funding. So if we know if good looks like, then how do we ensure that we have long-term funding? And I believe that our country is figuring it out, but it's kind of messy right now. We don't have a single funding source that all district can uniformly rely on. But there are great grants. There's actually a grant right now called Project Aware. The deadline is in late April. To give you an idea of how this has grown, last year there were about 2 million available total. This year there's about 40 million. You can see the growing support. And then of course you have the Safer Communities Act, which dedicated $1 billion. We have Medicaid dollars. And so as a school system, we're trying hard to figure out long-term funding, and we'll get there. We are getting there.
Right. And those numbers reflect obviously an awareness of the need as well. Obviously they do.
I agree with you.
Yeah. Now, like anything else, there are potential implementation barriers that districts should be aware of. What would you say are a couple of those that districts should think about if they're going down this pathway with your organization or others?
Yeah, the real limitation or struggle is the shortages and the burnout that we face in schools. There's a capacity challenge that all districts seem to face. And when a teacher is first hears this, they think one more thing for me to do. And I think the big challenge that we have to acknowledge is that there is a capacity hurdle, and we need to be innovative in how we address that. So the use of technology, there's lots of great technologies out there, not just ELuma, but others that help to build capacity, to create insight. The other one is the human innovating in how our kids interact with these amazing providers. And yes, in person is important, but virtual is also very important because we can pull great people into school buildings no matter where they are. Of course, partnering with community-based centers is a staple to our a good mental health programming, but they're even strapped. And so, the real first step is that readiness assessment. Let's assess where we bring technology and outside resources in to build capacity for our districts, because today we can't fully expect our people to be able to handle all of this on their own without a lot of
Absolutely.
support.
And that's where technology could be, so as you've already pointed out, so vital to actually reducing the otherwise demands that would be on teachers or in-house personnel to cover this issue. The capacity is not there, and
It's not.
unlikely to be there unless we support it with technology. And so I really applaud your organization for doing that. Now, if you wouldn't mind, please share with our audience how this work has impacted schools, organizations, or perhaps an individual. This is a chance. Just tell a story about this important work.
Yeah, I think that storytelling is a very important part of what we do because it's easy to get caught away in the data and into the process and programming. And we've been able to support over 40,000 kids across hundreds of districts all over the nation. And I have the privilege of hearing some of these success stories and really seeing the tremendous impact. In a recent conversation with one of our districts in California, they said, "Oh my goodness, we want our counselor back next year. Doing it virtually has connected with our kids so tremendously well. It's been so incredibly valuable." We're also working with a district in Montana that serves both a tribal nation and non-tribal nation students. And what's been incredible is that district has been able to bring someone in with ELuma's support who can empathize and understand a tribal nation, whereas they didn't have that resource. And one of the biggest comments around counseling is being able to relate and empathize with someone who might look like you, who has a background and is similar to you. And being able to do that with this district in Montana, this district in California has had a tremendous impact on the diversity of those populations. And another one that I think is worth pointing out is Pittsburgh Public Schools. The whole goal there was to serve an underserved community and a marginalized community who wasn't able to access these critical mental health counseling supports outside of school. So these kids who normally wouldn't have those services now get them. And there are counselors that look like them, that relate to them, that can help them. And it's something that we're really, excited about, and looking to partner with forward-thinking districts to really have a big impact on the mental health needs of kids across this nation.
It's interesting, Jeremy, because you pointed out three different kinds of districts. And, out there, I'm here in Texas. Obviously, we have a diversity of districts, just like every place across the United States. And so, what's obviously important is being able for a district to be able to connect with like districts to see this kind of work.
Mm-hmm.
So what I'm going to ask you is just simply if a district was interested in exploring more deeply into this work and really start connecting with districts, how would they go about contacting you and arranging for a deeper conversation?
Yeah, we invite it. We really do look to have conversations to see how we can partner, because this is new for you, it's new for this country, and we bring a lot of potential experience and expertise that can benefit. Our website is eluma.com, and you can find a lot more information there. And then my email is jglauser@eluma.com, J and then my last name. And I invite you to reach out. I love connecting and collaborating, because really, truly, it's going to take not just ELuma and not just the district, but a lot of partnerships in communities, government, private, for-profit, nonprofit. And I am very optimistic about the momentum that we've built, and appreciate the opportunity to share some good information with your audience today, David.
Thank you, Jeremy, and especially thank you for being a part of the important work of supporting our students in schools. And thank you for your participation in a L.E.A.R.N podcast.